Hi, everyone. Thank you for joining us this afternoon for a presentation with Chelsea and Marilyn. My name is Anna Guida. I'm the project manager for Empower Idaho, which is a project of the larger nonprofit Janus. We do education and advocacy for adults with behavioral health conditions throughout the state of Idaho. We do lots of educational kind of activities and webinars, training, live and in person when it's safe, throughout Idaho about a lot of different topics. So we're super excited to have these two awesome resources here today. A few quick notes before I pass it off for their introductions. We will be recording this webinar, and we're hoping that the subtitles will be recorded as well. Also, there's opportunity to ask questions throughout the presentation. In your control panel on the side, there should be a questions or a chat box option for you. So feel free to type questions that you would like Chelsea and Marilyn to answer, and we will I will field those to them when they take breaks throughout the presentation. Also, there are 5 handouts that you can access in your control panel. And so if you go click on those, you can download them and refer to them throughout the presentation. Additionally, there'll be 2 polls that'll pop up, and we encourage you to participate in those as well. So that's all I've got for now, and I'm just super excited and grateful for these 2 awesome folks to be here. So I'll pass it off to you both to get started.
Great, thanks so much, Anna. My name is Chelsea Smith, and I'm the Communications and Project Coordinator for the Family Caregiver Navigator project, which is a pilot project of the Idaho Caregiver Alliance and Center for Study of Aging at Boise State. So I will let Marilyn introduce herself as well.
Hi there, everyone. I'm Marilyn Sword. I'm the coordinator for the Idaho Caregiver Alliance, and I'm a consultant with the Family Caregiver Navigator project. Back to you, Chelsea.
Great. So today we're going to talk about kind of the state of caregiving in the U.S. and Idaho right now. And then we're going to kind of walk through an evidence-based intervention that we have developed or worked with for this pilot. And that assists caregivers in connecting them with really needed resources, one of them being respite, at which point I'll hand it over to Marilyn to kind of go into some of the respite options here in Idaho. And we'll talk a little bit about how you can refer folks to the program, and of course, time for any questions and comments as well. So the Family Caregiver Navigator project, as I said, is a 2-year pilot with the Center for the Study of Aging and Idaho Caregiver Alliance, as well as a suite of other amazing partners. And it's a free service that serves caregivers across the lifespan. Right now, it's only in Southwest Idaho because of the funding limitations. And it's an options counseling and resource referral service via telephone. So we'll talk about kind of what that means, but just know that it serves caregivers 18 plus in Southwest Idaho, and they can be caring for someone of any age. So, you know, age 0, 6 months up to 101. And as I mentioned, we use an evidence-based intervention, and any adult who supports someone with a physical, intellectual, cognitive disability, chronic or mental health condition can participate. So that's one thing that we're really excited about the program, is that it's a very open eligibility requirement. There's not a lot of hoops to jump through. Really, people just have to call and be willing to participate in order to accept this program. So before we get started, I want to ask you all, are you a caregiver? Now, I'm not talking about your role as a provider necessarily, your professional paid role, but are you a family caregiver or an informal caregiver? So if you just answer the question that pops up, then we'll just get a little bit of a read on who we're talking to. And if you don't know if you're technically a family caregiver or not, that's fine too. That's something we will talk about as well, kind of what the definition officially is according to the Idaho Caregiver Alliance.
We've got about 80% voted, so I'm going to give it a few more seconds.
All right. We didn't cue the Jeopardy music for this, but you can imagine that playing. Okay. Oh, there we go. So it's 64% said yes, 36% said no, and 0% said unsure. So that's helpful to know, and sounds like a good number of you have caregiving duties in your personal life. And then 36% said no, but we know that statistically 1 in 4 people in Idaho have caregiving duties. So there's probably someone in your family who is a caregiver. And that's something we like to make sure people remember, is that caregiving affects every family, and a caregiver's well-being is directly related to the well-being of their loved one. In other words, caregiver well-being equals more patient well-being. And sometimes that's a little bit of a shift because we're so focused on the person with kind of a higher medical need or who has a more official diagnosis. But the research that we have found supports the evidence that when caregivers are healthy and supported and not burned out, it yields not only positive results for their health, but also it impacts obliquely the patient's health and well-being as well. So we know that this is a great preventative way to just lay some really good groundwork for families to be successful in keeping their families in home and supported in their caregiving duties. So I like to put this slide up there, you know, because a lot of people, probably not folks in your position, but maybe in the population at large, kind of tends to think of caregivers as elderly folks, as often older women, or more like a in-home care worker as a caregiver. But the truth is that caregivers are actually really becoming much more diverse, just as the general population is. So these are some stats from the AARP in 2020. Nationwide, we're seeing almost 40% of caregivers are now men. And we also see that while baby boomers have the lion's share of caregiving still, we have about 23% of caregivers who are millennial generation and 6% Gen Z. So that's a significant population there. It's almost a third of the overall caregiving population. And not to mention a lot of multicultural, not to mention a lot of multicultural demographics as well, which we'll get into. You also see here that we have a large percentage of folks are working. 61% of folks are working. And in Idaho, that number is actually 70%. So 70% of caregivers in Idaho are also employed. So as you can imagine, that means that these are really busy folks. The average person is spending 20 to 25 hours a week caregiving, and there's a lot of stressors involved in that. Also want to mention minority populations tend to take on more caregiving duties than their white counterparts. Black and Hispanic caregivers provide more care to a loved one in home than their white counterparts. American Indian Alaska Native folks are more likely to pay for health-related caregiving expenses than their counterparts. LGBTQIA plus folks become caregivers at a higher rate than the general population. And immigrant caregivers not only make up 11% of the paid workforce of home health, but they also make up 26% of the informal sector. And millennial caregivers are more likely to be supporting someone with a mental health condition and more likely to be employed as well. So we find that while caregiving is a pretty ubiquitous issue, it kind of looks different depending on the cultural expectations, depending on the family culture and the context in which the caregiving is occurring. So I like to just define it for folks just so that we're all on the same page, because every caregiving journey is unique. So we define caregiving as something that can happen across the country or in your own home. It can be for a friend or a relative or a neighbor. You know, it can be, you know, getting groceries for your neighbor during the pandemic, or it can be 24-hour care for, you know, a loved one with dementia. So it's really a range. And the caregiving experience, as I mentioned, can be really impacted by the cultural context and family expectations. So providing emotional support is definitely a form of caregiving, but we're also looking at some of those more concrete tasks like driving to doctor's appointments and other services, arranging and preparing meals, assisting with chores, completing forms or documents, making phone calls, maybe doing translation for your care recipient, assisting with bill payment, arranging services for long distance for a friend or relative, assisting with medications, and providing cash to pay bills. Some people are even providing a level of care that could be considered, medical care with limited training too. So we have caregivers really up against a huge cascade of duties and things that sometimes they're not always prepared for. And there's an invisible toll on caregiving that we talk about at the Idaho Caregiver Alliance, because as I mentioned, they're often spending 25 hours a week providing care, which on top of employment is, incredibly demanding. Mental and physical health decline significantly in the first 5 years of caregiving due to chronic stress. And this population is statistically more likely to neglect their own medical and health needs. So it can accelerate some of those problems. So we kind of talk about this iceberg of caregiving, where at the top, we're really focused on that individual receiving care, the care recipient, but really below the surface, there's all these impacts on the health of the caregiver, on the family, on their employment. We have a lot of folks retiring early or turning down promotions in order to be a caregiver. So there's a lot of financial impact that can happen as well from family caregiving. That is kind of an unseen impact to the general public. Here's a graph that just shows that there was a 7% reported decrease in quality of health, according to the AARP, for the average caregiver in those first 5 years of caregiving. So, as public health people, we're really focused on what we can do to prevent these things from getting worse. Because caregiver stress is not only bad for them, but it's bad for the patient, as we mentioned. So caregivers who are stressed and burned out are more likely to use emergency crisis services, perhaps inappropriately or without the need to do that, but they kind of get pushed to that point. They're more likely to place their loved ones in long-term care, perhaps prematurely, simply because they don't have the supports in place to really feel like it's a sustainable solution. They're more likely to show higher levels of anxiety and depression, yet they have lower levels of self-efficacy. And I thought this was interesting, 40 to 70%, that's quite a range, but I found this in multiple places, so I thought it was worth mentioning. 40 to 70% have clinically significant signs of depression, and 25 to 50% meet the diagnostic criteria for major depression. So we have a huge mental health toll that's happening on the caregivers. And as you know, that impacts immunity, and it impacts existing conditions, and just exacerbates things for the caregiver as well as the patient. So one thing, we'd like to ask all of you today is to start seeing caregivers even when they don't see themselves as caregivers, because that's a barrier sometimes to the work we do. When people acknowledge that they're a caregiver, they're more likely to seek help and also be using the correct language to solicit the help that they need. There are some resources out there for caregivers, and Marilyn will talk a little bit about that. But if you don't know you're a caregiver, you don't always know what to Google or who to ask or what to find. So we ask you to see caregivers in the healthcare setting, even though they don't always see themselves as caregivers. So we have 3 personas here that we like to refer to. There's Dale, who's caring for his wife with MS, and he says, "I'm just a husband doing what I promised to do until death do us part." And Lacey, a young mom with a child with developmental disabilities, and she says, "I'm not his caregiver, I'm his mom." And then we have a grandparent caring for a relative who says, "I'll do whatever I can for my grandchild. It's not their fault they were born this way." So a lot of caregivers see themselves as simply fulfilling their familial duties. And the reason that becomes an issue is that because they are becoming a caregiver and they're trying to reconcile their role as a spouse, as a parent, as a grandparent, and a caregiver. But unless they can really see that they're also a caregiver, those two identities come at odds with each other. And that's part of the evidence-based intervention that we've implemented for this program that I'm going to tell you about now. So when we ask, how can we support these folks? Well, there is the Family Caregiver Navigator project is one way that we're really trying to intercept those stress cycles with caregivers and help them strategize and problem solve. So just to give you a high-level view of how this works, a lot of times folks are coming to us through professionals, providers who are referring them to the program, but it's really important to note that nobody needs a referral to come to the program. They can simply call or hop on the website themselves. But we know that these folks are stressed, they're overwhelmed, and again, they might not see themselves as a caregiver. So it's going to be really helpful to have those trusted professionals nudging them in our direction. And we've been working with a lot of clinics and community organizations to be doing this so far with some real good success. And so for whatever way the caregiver comes in the door, they make contact with us, and then they connect with the navigator by phone. Now, the navigator's job is to take the caregiver through an extensive assessment that looks at a number of their stress factors. And then they build a care plan that focuses on their health and wellness, not the wellness of the patient, but the caregiver's health and wellness, and identifies critical resources that can assist in the region and provides a warm handoff to those resources. So just to walk it back for a moment, this is a program that is delivered through a software platform called TCare that was developed based on 35 years of research by Dr. Rhonda Montgomery out of the University of Wisconsin-Milwaukee. And one of the reasons we chose this intervention is because there's been some really great success in the state of Washington with this program. Of course, they have a different system in Washington, and frankly, much more support for caregivers through Medicaid and their other assistance programs. But it's still an impressive result that they were able to measure that the program reduced long-term care use by 20% and delayed nursing home placement by 21 months. So it's improving the ability for the caregiver to support their care recipient without relying on long-term care. And then participants who stayed in the program for at least 6 months had significant reductions in depression and stress, even with an increase in caregiving duties, which I think is really interesting because that tells you that a shift has been made that is still supportive even when caregiving continues to get stressful, because it does, especially if somebody has a progressive diagnosis. So those are really promising, exciting results from the state of Washington that we're hoping to replicate on some level here in Idaho to demonstrate the level of need. So in many ways, from our organizational perspective, we are gathering that critical data to demonstrate the value of supporting caregivers to our state policymakers and the powers that be, so that we can show that supporting caregivers can offset costs to the healthcare system in really critical ways. So the assessment it takes about 30 to 45 minutes, and the navigator walks the caregiver through these different questions that fall into these different categories. So we look at the relationship burden, which really is the quality of the relationship between the caregiver and the care recipient. These are often very stressed relationships because of the caregiving has impacted their relationship. So we see a lot of guilt, a lot of stress, a lot of fear, and grief as people, transition their relationships, especially with folks who are, for example, folks who are having dementia and Alzheimer's. There's a lot of grief that goes into accepting your role as a caregiver there. So we really look at the quality of their relationship and how that's going. Then we look at the objective burden, which is really a calculation of the human power of how much time they're spending in chores and daily living activities. So we try to quantify that. And then we look at the stress burden, which is really how they feel about these things. We find that there's certain aspects of caregiving that are going to be really stressful and others that aren't. And it really depends on the person's skill and the person's, personality. So it's a very personalized process. I want to mention this assessment and care plan. We're really looking at what are the pain points for the individual. For some folks, they might not mind the daily chores and bathing and feeding, but they might be really stressed by having to manage all the finances now that their husband has Alzheimer's, for example. So we're really trying to pinpoint what are the biggest stressors, where do you need help or training or support, and that's part of that stress burden. The identity discrepancy goes back to my comment about embracing your identity as a caregiver, because if you can do that and find meaning and balance in your caregiving, we find that it's a much more sustainable solution to be a caregiver. So the identity discrepancy is very important because people need to reconcile their role as a family member and as a caregiver and find a way to integrate those things so that they can move forward in a positive way. So this gives you, after they get the assessment results, they set up another appointment, and the navigator walks them through setting up 5 health and wellness goals. And we look at how to improve their overall health, reduce generalized stress, and change some of the rules that they have for their personal care. And so, this goes into different categories. And again, keep in mind, this is focused on the caregiver's health. However, we know that sometimes, the patient's well-being and health is going to impact the caregiver health because once again, they're connected. So there's going to be some, looking at, okay, if you need respite for you can't take care of yourself until you get respite, right? So we'll get the respite in place. And then once you have the respite, how do you want to use the respite? So those are the kinds of strategies that the navigator will work through with the caregiver and help them focus back in on themselves, which is a big mental shift for them because they've been so focused on their care recipient. And a lot of times they're really surprised to see the results of their assessment. This is just an example. It shows them how much time they're really putting into taking care of their care recipient and some of the stressors that they're facing. A lot of people don't realize that they have depression, as you probably know full well with your clientele, until it's kind of staring them in the face a little bit. And this care plan can help be a tool for caregivers to talk to their providers. And we ask them to take this to your doctor, take this to your therapist or your counselor to have a discussion, because we're just there to facilitate, right? We're not, we're there to connect them to the resources they need. And this care plan is just a tool for just that. We only set 5 goals with them because we don't want them to be overwhelmed. And as I said, we provide warm handoffs. So we really try our best to connect them directly with one of our partners or somebody we know who can assist, so that they don't feel like they're just being handed a list to have to go cold call and that's overwhelming with everything else they have on their plate. So we work really hard to connect them directly with the resources that we recommend. And this is just an example, taking it back to those caregiver types that we talked about. We might connect Lacey with the YES program, or Idaho Federations for Families, or Idaho Parents Unlimited. Dale, we might connect with education on the disease, powerful tools for caregivers, which is a phenomenal national class that helps build resiliency for caregivers. And we might recommend relationship counseling for that relationship burden. And for grandma, Leah, we might recommend Idaho Relatives as Parents, a great organization supporting kin care, and the Area Agency on Aging, as well as the Center on Disabilities and Human Development. So again, we are ideally connecting them with specific contacts at these organizations so that they can, so it's just a little easier to take that next step. So there's all kinds of supports that we recommend for caregivers, and these are just a few of them. And now I'm going to turn it over to Marilyn to talk about respite, but since I just threw a lot of information at you, I just want to take a moment to ask if there are any questions at this point before we move into the respite section about caregiving in the Family Caregiver Navigator project.
And again, if you have any questions, please use that chat or question box in the control panel, and we'll get those right over to Chelsea and Marilyn. But right now I'm not seeing any. Oh, actually, just kidding, we do have one. Someone is asking if we are able to share the handouts with coworkers and people who aren't attending. So yes.
Absolutely.
Absolutely.
Great. Well, I will email them out to all the attendees after this presentation.
Perfect.
That would be great.
Okay.
And yeah, Marilyn can take it over, and we'll have more time for questions at the end.
Right. Thanks very much, Chelsea. I want to talk a little bit more in depth about respite, but as you can see from what Chelsea has just presented, the supports that caregivers may need can really vary widely. It depends on their individual circumstance and situation. We've always said if you've met one caregiver, you've met one caregiver. But there are some broad categories of supports that caregivers ask for or rely on. Many of those deal, as Chelsea mentioned, with information or getting services for the care recipient. But once those are addressed, and those can change, but once those are addressed, then the family caregiver can back up and spend some time focusing on themselves and what they need. And one of the most frequent supports that caregivers request or think they need, they often need something different, but think they need, is respite care. So do you want to advance the slide, Chelsea? So for caregivers, especially those providing 24/7 care, a break is often needed, but it's often postponed or simply not taken at all. This contributes to the caregiver's overall stress and their inability to maintain the resilience that they need in the face of difficult and demanding circumstances. So what is respite? Respite is a temporary relief for a primary caregiver, enabling a much needed break from the demands of caregiving for a sick, aging, or disabled family member. Whether it's just a few hours a week or a vacation, seeking respite care can help ease the burden of family caregiving and help to relieve stress, restore energy, and promote life balance. It can also prevent the caregiver from becoming exhausted, isolated, or burned out, which is kind of the whole aim of our Navigator project. But respite care can also benefit the care recipient, providing them with variety, stimulation, and a change of routine, which they may welcome. We get tired of seeing the same, we know from the pandemic, we're getting tired of seeing the same faces day after day, other than on Zoom. For caregivers, seeking support and maintaining health are key to managing their caregiving role. If a person is overwhelmed by that daily grind of caregiving, their patience and compassion will wear thin. They'll find it harder to connect with the care recipient, and both the caregiver and the care recipient may feel frustrated and unfulfilled. And that can lead to some other things like neglect or abuse or things that we want to avoid by making sure that that caregiver has the supports that they need. But after a break, ideally the caregiver will feel more energetic, focused, and invigorated to continue their caregiving role. Next slide. So here are some examples of respite resources in Idaho, and I want to stress that these are just examples. I mean, there's respite that are provided by volunteer organizations or by the senior center. I mean, there's a lot of respite out there, but it may not be called respite. So you kind of have to dig a little deeper to find the respite that makes the most sense for you. In the upper left-hand corner of this, we talk about the Idaho Respite Care Voucher Program. This is a program that is for families of children with serious emotional disturbance. And it pays for respite services to providers, and the providers are chosen by the family. This allows families to decompress or attend to important matters with the peace of mind that their child's being cared for by someone that is already familiar with that child and is equipped to care for them adequately. There's some criteria. The child must be under the age of 18 and be an Idaho resident and have been assessed by a clinician and determined to have a mental health diagnosis and a functional impairment. And these respite services have to be included in the child's treatment plan or person-centered plan. And the parent will be emailed an authorization valid up to 6 months for $600 per child. So if they have 2 children that fit this category, they can get $1,200. Families who are currently on Medicaid are encouraged to contact Optum for agency respite care services. And kind of all of this runs through Optum for approval, authorization, and payment. The program also allows that primary caregiver to pick a non-agency person, somebody that's in their family's life that their child knows and is comfortable with. Could be a relative, could be a neighbor, could be a friend. And but the respite provider, there are some qualifications for that provider. They have to be 19 or older, or a minimum of 4 years older than the child. So if the child is 17, they would have to be older than 19, obviously. They should be a member of the family's natural support system. They can't reside in the home, and they must be independent from a provider agency because the only service they're going to be providing is respite. There's no formal training requirements. The primary caregiver just has to be comfortable with leaving their child in the hands of this respite provider, and the services are authorized and paid for through Optum. Then moving over to the upper right-hand corner is consumer-directed respite. Consumer-directed respite is a fairly new program that's being offered initially through the Area 3 Agency on Aging, but it's poised to start rolling out statewide, particularly in eastern Idaho and northern Idaho. And it allows up to $600 in payment for every 6 months. And it's for a person caring for, an adult caring for someone of any age that has a chronic disability, an illness, or a special need, and they apply through the Area 3 Agency on Aging. They choose the respite providers. And once again, it's like the one above. It can be a family member, a friend, a neighbor, but this $600 allows the family to maybe be more comfortable asking for respite because they can, say, buy a tank of gas for the neighbor or give them an Amazon gift card or something like that. It just kind of takes the edge off and encourages the family to reach out. It's also excellent in rural areas where there are no providers because that means that somebody that the family knows could then provide the respite. Then you move down in the bottom half of this square and we're talking about Medicaid. If you have a person who's a senior or a person with physical disabilities or mental illness or a combination thereof, they can get services on the aged and disabled waiver if they're Medicaid eligible. And these can be, there's a whole laundry list of services like homemaker services, chore services, companion services, personal care services. And these are all paid for through the independent living center in your area. And you just identify who you want to provide the care. They will connect with the independent living center who will handle the kind of fiscal end of things and reimbursement. But there, you also can have private pay through the independent living center. It doesn't have to be just for those folks on Medicaid. And last, the developmental disabilities waiver. We have one in Idaho for adults and for children. And respite is a service that is included or can be written into the plans for kids with developmental disabilities or adults with developmental disabilities. And for each type, there's a traditional option where providers are paid for providing prescribed services to the individual services that are included in their care plan, or they're self-directed, or for kids, there's family-directed. And that's where the family or the individual chooses their service provider. They have the support of a support broker to help them. And the fiscal payment is made through a fiscal intermediary agency. So it takes a lot of oversight by the individual or the family, but it's much more flexible, and respite can be written into those plans. Next slide. So we talked a little bit, I'm not going to reiterate a lot of these, but services, a person can come into the home and provide respite. And who comes in will depend on the needs of the person being cared for. It may be a home care agency, it may be personal care services from the Independent Living Center, it might be homemaker services from the Area Agency on Aging, or it might be someone from home health that needs more training to provide adequate respite for somebody with more complex needs. But these are services that are provided in the home that allow you, the caregiver, to engage in some respite activities of your choice or need. Next slide. Or there's out-of-home respite. And this is the difference here, is the person who's the care recipient is taken someplace out of the home, which it can be a nice change of pace for them. We often think of adult day centers that might be attached to residential programs, where a senior or an adult can go just for a few hours, for an afternoon. Senior centers are a place where families can take their relative for lunch or bingo or something else, and that allows the caregiver some time to attend to other needs and get some respite care. You can see the list of residential programs here: group homes, intermediate care facilities, nursing home, hospitals. It's going to depend. We've heard from families with children with really complex needs that sometimes to get respite, they have to put their child in the hospital, which is an expensive form of respite. But for those kiddos with significant disabilities, that can be their only alternative. I want to mention certified family homes, because for the last couple of years, certified family homes that provide care from 1 to 4, provide residential supports for 1 to 4 people. The last couple of years, the rules have been changed that allow certified family home providers to provide up to 8 hours a day of respite for someone who isn't living in their home. And this has been a nice way of expanding respite options available to families. I had a call yesterday from a woman who she and her husband are providing a certified family home for their adult son. And she wanted to know more about how could they provide respite to somebody else who has an adult child with a disability who could come into their home for a couple of hours. So I connected her with Steve Millward at the Department of Health and Welfare, who runs the Certified Family Home Program in Idaho. And hopefully he can help her set that up. But that's a nice new option for folks. And then caregiver retreats and respite camps. We have one of these here in the Treasure Valley, and it's called Hike to Heal. It's a small program that the Commission on Aging it's one of 7 or 8 programs around the state that the Commission on Aging has awarded some money to get their program up and running. And this respite program is for caregivers who'd like to go camping and hiking, and they are the caregiver of an individual with cancer. So those are just some out-of-home options. Next slide. And of course, there's informal, there's family and friends. That's the kind of natural way we think of as providing respite, is that Your sister comes over and stays with mom while you go do the grocery shopping, or while you go get your hair done, or something else. Family members and friends can be a great resource to primary family caregivers, allowing them to even go on vacation, depending on the situation. Caregiving can be a tough process for families to share. Even the healthiest families can be severely stressed by ongoing care, and the division of labor is frequently lopsided. Some strategies that primary caregivers can use to encourage support and participation is to communicate. Family members often don't share kind of what's involved in the day-to-day caregiving experience. And so the non-primary caregiving family member may not have an appreciation for what the caregiver actually does. Encourage the family members to evaluate what they can reasonably and honestly do. Changing roles and varying resource levels can impact family involvement. Is the primary caregiver employed? Chelsea talked about how many caregivers are employed in Idaho, and she's taking care of mom, and maybe your brother is able to provide financial support. So those are kind of a mix and match of caregiving activities among family members. Caregivers need to recognize their own feelings and discuss the disproportionate tasks that caregiving can come with. And they need to be able to be specific in their asks for assistance and help. Can you come over on Tuesday? I have an appointment for 2 hours and help my brother with this. So it's a very specific request, and that makes it easier for the other family member to kind of know how they fit into the picture. And use technology. I think if we've learned anything in this time of COVID, it's that Skype and Zoom and FaceTime and all these things like what we're using now are ways to help people stay connected. And other family members, particularly those who live a long distance away, can help the primary caregiver take care of the person. And caregivers can learn a lot from support groups in terms of strategies, how other caregivers cope, and when other family members are not willing to step in, maybe support from support groups can help fill that gap. Next slide. So I think that there's a variety of things that caregivers can be encouraged to do to overcome barriers. There's a natural barrier to taking respite care. While it might seem obvious to others that the caregiver really needs respite care, they don't always step away from that role easily. Handing over that responsibility to someone else can be daunting. Caregivers often feel that their daily caregiving routine is too complex to explain to somebody else. It's just easier for them to power on through than hand over the reins to somebody else. Or they feel like maybe it's wrong to ask for help. That it may be interpreted as that they don't care about the person they're caring for. They're worried maybe that the person taking over for them will not do a good enough job. Or maybe they're worried that the person will do too good a job and it will make them look inadequate or no longer needed. So you'll see some tasks or strategies that can help caregivers overcome these barriers, recognizing that it's a normal part of life, looking for the best alternative caregiver, realizing that it's not abnormal to need a break, that respite care can provide a fresh perspective both for the care recipient and the caregiver and the respite provider. And it can be done like a swap. Having another child come over for an overnight gives that child's parents some respite time for the evening, and then maybe you can return the favor. It's good to have these planned. I know there's some apps that you can use that allow caregiving to kind of be mapped out on a calendar. And so that's a way to share the caregiving responsibilities and give other people a chance to sign up on a specific day for a specific task. Next slide. So what can you as providers do I think the first thing you can do is recognize that family caregivers are a part of your healthcare team. You are a critical care provider for that person, but when they leave your office, the caregiver is assuming the responsibilities for that person. So encourage the caregiver to share information from their perspective. And I realize that there's HIPAA things, but share what you can, some strategies for you to help them when they leave and go home. And remember that these caregivers come in all shapes and sizes and ages. So there's, it's not just older folks caring for caregivers. So, and then check in with them. Check in with these family caregivers. Do they seem tired? Are they anxious? We have a self-identification questionnaire. We've got several versions that we can share with you that can be provided to caregivers that can help them self-identify, because most caregivers don't recognize themselves as caregivers. And ask how they're doing and if they need help. You can refer them to support groups, refer them to other services, refer them to the Family Caregiver Navigator. And we have this handy dandy RX pad that is an excellent way for you to refer caregivers. You can refer them obviously online, but this little RX pad is just where you can write their name and your name and tear it off, and they can take it home. And it has all that information about how they can access the Family Caregiver Navigator program by phone or online. So we would really recommend, and we've got these, and we can get these to you if that's something that you would like. So that's, I would be happy to take questions about respite, or I'll turn it back over to Chelsea to talk about our upcoming Family Caregiver Conference.
Any questions about respite?
Yes, we have a few questions. Just real quick, if you raise your hand, if you're an attending, you raise your hand with the hand raising option, go ahead and ask your question in the chat box so I can relay it over to the presenters. So the second question I got was this one. It's long, so I'm going to read it out real quick. Are these the same services offered to caregivers providing care for family members from a distance, out of state? For example, caregivers attending appointments by phone, managing care, finances, etc.
I guess I'm a little unclear about the Family Caregiver Navigator is absolutely a resource that can be used by people locally, even if their caregiving is distance caregiving, if I understand the question.
Okay, I'm just typing real quick for clarification. So if you need more, if you want to ask that question and elaborate on your question, we're more than happy to pass it along to presenters. So, okay, let's see. Next question. Just the name. Okay, so someone was asking for clarification on the name of one of your programs, and I believe it was the slide that had the example of respite resources in Idaho. And the top left slide, and I see that's the Idaho Respite Care Voucher Program. So the person who asked that, his name's Susan. So Susan, if that's the program you were asking about, just confirm with me in the chat box. And yes,
that program is one of our handouts has extensive information about that program.
Okay, awesome. So yes, please refer to those great handouts we have that I'll also be emailing out to everyone who is attending today. So any more questions, you can pass them on my way. Oh, here we go. If a caregiver needs resources to get an adult services to establish a budget for an adult with disabilities, can they call the Idaho or the Family Caregiver Network?
I would absolutely recommend that they do that. It's going to give them more than just establishing a budget. We'll probably connect them with an organization such as Link that helps folks do exactly that. So that would be one of the resources we point them to. But if they come to the Navigator, that'll help us see the big picture of things that need to be done. And Link would be one of those resources that could help them with establishing a budget. If that sounds correct, Marilyn, please correct me if I'm wrong or add anything.
No, I think contacting the Navigator would be a great help. I think if folks are trying to establish a budget for some services for the person they're caring for, they're going to be needing to work with Medicaid, but depending on the type of service, they may need a support broker, they may need a case manager, but they're going to have to work through Medicaid to get that budget established and approved. But the Navigator can help with that process.
Awesome. We have one person who, it's not a question, they're just thanking you for all these resources and that they're happy to know that there are more respite options than they were aware of. So thank you both for sharing.
Good. That's great to hear. Yeah, and the handouts that Marilyn provided are, they're very dense with information because these are complex programs, but they're very comprehensive. So definitely good to just keep those handy. And I also included some digital materials of our program in there. I'll just share a couple more things and feel free to keep putting questions into the chat box. We do have a virtual family caregiver conference coming up in February. It's totally online, available to anyone in Idaho and frankly beyond Idaho. It's only $15 to register. We wanted to make this as accessible as possible for folks. And there's multiple tracks with, depending on your caregiving situation, whether you're, estate planning or end of life planning, or whether you're transitioning a child with disabilities to adulthood. There's a range of sessions and speakers, and it's going to be a really great opportunity to network too with other caregivers and a generally supportive environment. So definitely want to encourage you to check that out. And I'll make sure that Anna has that link, I guess, or maybe you could toss the link into the chat, Marilyn, if you get a chance. It's on the Idaho Caregiver Alliance website. But I wanted to show you the Family Caregiver Navigator website briefly, because this is a place that you can make referrals and also encourage folks to take the screener, which will prompt an outreach phone call from us. So here on the front page, we have Refer a Caregiver, and that button is going to take you to our professionals page where you can download materials, order print materials, submit if you have a private practice that you think could be beneficial to caregivers, or you work for a clinic that should be in our database, let us know. We want to make your resources a part of our caregiving plans. And then this is an opportunity to just directly refer someone to the program, as long as you have their verbal permission, so we're not cold calling them. We will give them a call and tell them about the program and see if they want to participate. So we're trying to make it really easy for folks to make a referral. I will also show you the RX pad in a second when I'm done with the screen share, but I wanted to take you back to this page. Note, we do have a Spanish page that explains the program in Spanish. We do have translation services available for people of any language. And the other couple things I want to point out here are the resource library. This will take you to the Idaho Caregiver Alliance website, which hosts not only the conference registration, but also this great library of some of the resources and community partners that we work with. So you can sort things by tags and get some information. Some of these are virtual nationwide resources, and some of them are local. And you can even sort by location as well. So that is a resource that we're continually adding to. If someone goes on here and takes the screener, which we have some clinics who are kind of encouraging caregivers to take the screener while they're in the waiting room as the patient is being treated. So if you have that capacity, this is a great thing to encourage caregivers to check out. It doesn't necessarily do any have any commitment to the program. It just gives them a 5-minute kind of assessment. It's kind of the first part of the assessment, and gives them some initial feedback on some of their stress points as a caregiver. And then what that does is just trigger an outbound call to see if they want to participate in the full assessment and the program. And if they don't, we just close the file, no big deal. So it's a pretty low risk way to kind of get a feel for the program. So I definitely encourage you to check out caregivernavigator.org. We have a lot of resources on here, and it's a great way to get in touch with us here. We have some newly minted quotes from some of our participants that are exciting sort of initial results showing that this is impacting people's caregiving style, and just frankly having someone to talk to about how complex caregiving is can go a really long way. So we outline the process, FAQs, and all of that good stuff on here. So that's a really good way to get information. So I think people can see my screen again, right? Because I wanted to just show, this is our little RX pad. So this is, we've modeled this after a prescription pad. For those of you seeing folks in person, this is a great way to just nudge them into the direction of the program. And of course we have postcards and brochures and things that explain things a little bit more as well. So would really be more than happy to mail those out to anybody who's interested. I'm going to put my email in the chat too, so that you can contact me directly. But it is almost 1 o'clock, but I want to let you know we're happy to stay and answer any questions as long as we need to. So please feel free to ask any more questions.
Yes, we did have a few that just came in, so I'm glad you're able to hang around. First of all, I put the caregivernavigator.org in the chat box. Marilyn included a link to the conference with more information, and Chelsea's email is also in the chat box right now if you want to snatch those up real quick. Also, those RX pads are really cute. That's such a good idea. Okay, so we have, I think, 3 quick questions. One is asking if there are CEUs for the conference that's coming up. Okay, awesome. The next question is, if a family is being provided respite from a clinic, can the child/caregiver also be provided personal care services since the child is struggling with basic learning skills? Or does Medicaid often prohibit both services at the same time?
I think I would say that if they are distinctly different services, there may not be an issue. But Medicaid is very reluctant to pay for double dipping, as they call it, so that families have to be careful about that. But if the services are two different services, then I think it shouldn't be an issue. It's gotten very challenging during COVID with getting children the services they need to help them both developmentally and educationally. So I think if you can talk to your provider about that and get some clarification from Medicaid, if these are Medicaid paid services, that may help. I'm sorry to not be more specific, but it depends a lot on the exact services and how they fit in the child's plan.
Okay, thank you. The next question is, if this is a pilot program, will the resources go away after the program ends?
Well, the resources will still be available. The resources we're referring out to are going to continue to be available. Right now, our hope is to find some, sustainable funding so that we can continue to offer this service to help connect those folks with the resources, since we're kind of becoming a hub for some of those resources. So, right now we still have 1.5 years left in this project. So we have hopefully plenty of time to find a sustainable model for that. But yeah, the resources we're referring to, most of them should continue to exist.
Can I add, we are also working to whatever we can do, if we can attract the funding for it, to take it outside of Southwest Idaho, because there's a lot of interest in other parts of the state. The area, a couple of area agencies on aging in the north and in southeast have expressed a lot of support for this. So, and we're looking to expand our capacity within the Latinx community too, recognizing that we do have some materials in Spanish and we have the language line, but it would really be helpful if we can get on board with having a navigator who's a Spanish speaker, who understands not only the language, but the cultural aspects of that. So we're working all the time to stay around.
And I hope you guys do. Well, I know I'll definitely be referring folks to your resources and to your program. It's just such a great resource for folks. Oh, and one more quick question. Oh, yeah.
I was just going to add on to that too. One thing I might not have made clear is that they can come back repeatedly after they finish their initial care plan to amend the care plan, to update it, to go through the assessment again and see how things have changed for the duration. As long as we're here and we have the ability, we're willing to work with them throughout those couple of years. So it's not a one and done thing.
Right. So that last question real quick is, any suggestions specific for caregivers of young adults?
Marilyn, I feel like that's more your wheelhouse.
I think it's great to connect with, to the extent that you can connect with other caregivers, whether it's through support groups, through the Family Caregiver Navigator project, that will give you some ideas about options for you and options for the young adult that you're caring for. If they're getting services that may, their needs may be taken care of, but it may not meet your needs. Your needs may be suffering and that you can't get away. You feel a little isolated, particularly in this time of COVID. So I would encourage you to connect with the navigator to explore options that help you with your caregiving responsibilities and help you.
Idaho Parents Unlimited is another great resource that we often refer people to, and I believe they have support groups and all kinds of resources for folks to connect.
And just because it's and it's not just for kids. I mean, they work a lot with children transitioning to adulthood and adults who are living in the community. The Council on Developmental Disabilities also has a lot of, although it does a lot of policy work, it does a lot, is well connected with services and supports for families of adults with disabilities.
Great. I just put that link to Idaho Parents Unlimited in the chat box for everyone. So if you want to kind of click on that quickly before we end, that will take you right there. It looks like we don't have any other questions at this time. I just want to thank our two presenters for their time and energy in creating this this presentation for us, and I'm happy that our conversation last year came to this end. So like I said, Chelsea's email is in the chat box. If I were you, I'd snag that up to reach out to both of them. And I just, once again, thank you so much for all you do for folks in Idaho and for caregivers and the important work that, I just appreciate you guys a lot. So thank you so much.
Thank you. Thank you.
And thank you to attendees for spending this hour with us. You have so many choices of places to go these days online with webinars coming at you fast. So thank you for choosing us. And we'll hope you all have a great weekend.
Thank you, everyone.
Thank you so much. Thank you.